Hello, my name is Lee Rysdale. I'm a registered dietitian working at NOSM through the Vice Dean's Office with curriculum and research roles with the Northern Ontario Dietetic Internship Program. I'm also an associate professor in the Clinical Sciences Division and will be presenting on behalf of my co-authors from the UME Nutrition Curriculum Working Group. We have no conflicts of interest. This workgroup initiative has received in-kind and stipendiary faculty support from the Vice Dean's Office and UME at NOSM. Diet is one of the leading risk factors for chronic diseases, and unhealthy eating is costing $5.6 billion annually in Ontario. Nutrition and lifestyle interventions are the cornerstone of chronic disease prevention as seen in clinical practice guidelines for obesity, diabetes, hypertension, and cardiovascular disease. Yet, in Northern Ontario, we have significantly higher related hospitalization rates compared to the provincial average. Nationally, medical students are dissatisfied with their nutrition curriculum, even more so at NOSM, with more than half of graduates surveyed in the past 3 years. Students are not only dissatisfied, they have recognized that the current nutrition curriculum is dated and disconnected. For example, medical trainees can report that they can proficiently describe the physiology of hypertension and prescribe the recommended antihypertensives, yet are incompetent and uncomfortable giving lifestyle and nutrition recommendations. Most of the current nutrition learning objectives are self-directed, which does not activate prior knowledge or consolidate to retrieve as future physicians. Through significant advocacy since 2016, the Nutrition Curriculum Working Group was approved and established in late 2019. Members include reps from each of the 5 UME themes, UME staff and students, as well as dietitian stipendiary faculty. With a 1-year time frame to return with a report and recommendations, one of our key activities was a needs assessment conducted in early March 2020. Using a convenient sample of Northern Ontario physicians and dietitians, 123 responses were received, 90% from registered dietitians. The sample was distributed in urban and rural settings, mixed practices, and diverse disciplines. There was physician and dietitian consensus on 4 key areas of required nutrition skills and knowledge, and potential gaps. The 4 areas were general practice issues, nutrition throughout the lifespan, therapeutic nutrition, disease management, and population and public health. This slide also includes the top 3 topics identified in each area. There were also a number of salient quotes that have been captured in the full report, such as this comment from a physician about the importance of diet and nutrition in disease management and the lack of training in medical education. Other supporting quotes from dietitians related to their challenges as practitioners. This included physician advice to clients that may not be evidence-based and their lack of recognition of the role of nutrition in areas such as mental health, as well as the key role of food and culture, and how to integrate this knowledge into supporting and/or motivating more healthful eating habits. Suggested learning methods varied with the topic, but it was felt that much of the recommended content could be integrated into existing curriculum such as clinical placements, case studies, and structured clinical skills sessions, as well as other NOSM initiatives, including the Culinary Medicine Labs, or CMLs, which continue as a pilot. The CMLs are a proven teaching strategy used in over 50 U.S. medical schools. This interprofessional model builds nutrition competence as seen through our own evaluations, which have been presented regionally, nationally, and internationally, and in the literature. Overall, Northern dietitians are keen to support the development and implementation of nutrition curriculum at NOSM and are well positioned to do so. Wellness and nutrition, with a number of suggestions, including the CMLs, which again is a model shown to improve personal health behaviors and perspectives, and as a result, medical graduates may be better able to counsel their patients. The survey results provided valuable insights, such as the need for enhanced interprofessional collaboration and skills to support socially accountable care in Northern Ontario. This includes referring to dietitians, using motivational interviewing skills, and evidence-based recommendations in chronic diseases such as obesity and diabetes. As well, dietitians felt that they could support much of the curriculum content in years 3 and 4 for UME, while this data could also be a starting point to CME needs for Northern physicians. These report findings, along with a UME nutrition curriculum framework from Deakin University in Australia, has informed the working group's activities over the summer. We are not asking physicians to be dietitians, but we feel there are 4 knowledge and 5 skill-based competencies that should be achieved by graduation. This slide is an example of a knowledge competency and the associated learning outcomes. Examples of subject matter to address these outcomes, examples of outcomes that can be implemented into existing topics, and the assessment methods. We have adapted the framework by mapping to the NOSM Medical Education Program Outcomes, or MEPOs for UME, used Canadian terminology and the Northern context. Our working group and each of the 5 themes have reviewed and provided feedback to inform our final report, which will include recommendations such as ongoing working group activities to determine recommended resources, references, as well as instruction modalities. In addition to a final report to the UME Curriculum Committee, there is work underway to pilot some of the framework learning outcomes through a few of the themes, as well as continue to deliver the CMLs virtually and in person and evaluate using the 9 framework competencies. As well, there is a related NOTAP intern research project this year that will gather baseline data from UME students in years 2, 3, and 4, similar to a national study, as well as a more recent evaluation at Dalhousie University. Lastly, there's participation on a national working group through Dietitians of Canada with representatives from a number of Canadian medical schools to determine how to support more formal integration in Canada's 17 medical schools. For more information, the full report is available at this link. The following 2 slides are the corresponding references for this presentation. Thank you.